Welcome everybody, good afternoon. Welcome to our webinar this afternoon, our fourth in the series of our CQC Well-Led Webinars. Great to see so many of you again. Familiar faces, some new faces, still a nice range of CQC providers. We've got some local authorities, some dentists, some care homes, some NHS GPs and some private GPs, I think. So welcome all. I'm Dr. Claire Sieber. I'm a practicing GP and until 15 minutes ago was running rather late, but I've made it on time. And I run the Well-Led practice with a team that you will get to meet shortly. And as I said, this is our fourth CQC webinar series where we're taking each quality statement that sits under the Well-Led key question in turn and unpicking it in a lot of detail with the help of my lovely team. And this week's one is the Workforce Equality, Diversity and Inclusion Quality Statement. It will be recorded and you will automatically get sent the link afterwards so you can view the recording, and you will also automatically be sent the slide deck. So no need to worry about making copious notes. And on our YouTube channel, where all of the recordings are, you can catch up with previous ones that you might have missed. So the usual format applies today. We'll unpick that well-led quality statement and we'll give you recent examples from CQC reports to show you what has been highlighted by the CQC as good practice that's helped an organisation to get good or even outstanding, and what the CQC have picked out as being not so good, that's meant an inadequate or requires improvement rating. So you can really see what is actually needed in terms of evidence. And then we'll put our former practice manager and our current GP partner in the hot seat, and Gabby will give them the usual grilling that she normally does. I'll briefly talk about our platform and how it can help you with this quality statement, and then we'll have a Q&A session from you, the audience. The chat function is open, as is the Q&A thing, so feel free to put your stuff in there as we go along or at the end, or put your hand up if you're desperate to ask a question, and we'll try and get through everyone. So I'll let my team introduce themselves now, starting with Gary, if I may.
Yeah, hi everybody. My name's Gary Hughes. I was a practice manager for 13.5 years in large training practice in Berkshire. I now work with Well-Led as an associate and help practices and PCNs in a whole manner of things, leadership being an important one of those.
Thank you, Gary. And Ketan, can I come to you next?
Yep, I'm a GP partner of 16 years, also locality lead where I am and federation director.
Thanks, Ketan. And Gabby, I'll let you introduce yourself and then kick off with the first part of the webinar.
Great, thank you. Hi everyone, my name's Gabby Ashton. I am a former CQC inspector and I now provide CQC compliance and quality improvement support across the health and social care sector. So I've been working in this field for nearly 15 years, so nothing I haven't seen yet from a CQC point of view. And welcome everyone. Great, so as Claire mentioned, for those of you who have attended before, we start by looking a little bit at the data that's been published from the CQC website, and we take a look at this month, and then we're also capturing this data over the period of the 12 months, so we're able to see what's happening as we move through and as the single assessment framework is rolled out more across the country. So we can see here the differences between the GP practices that were published and the care home reports that were published in the month of April. For those of you who have been with us for a while will know that the outstanding percentages tend to be incredibly low. So unfortunately in April we didn't see any reports published for the outstanding rating. And yeah, we're looking at sort of 60% for GP practices that had a rating of good and 40 that had requires improvement or inadequate, which I'm sure you'll all agree is quite high. And similarly, nearly just over 65% of care homes also had a rating of requires improvement or inadequate. So it shows the importance of these webinars and working with the Well-Led provider and other organisations to make sure that you're familiar with your CQC knowledge and how to manage compliance in this area. And then if we look again at the 2024 so far, the statistics don't really change much between month to year, so we can see that there is still an incredibly low percentage of services that have received an outstanding rating, and sort of mid-range for the goods, and still unfortunately far too many that are receiving poor ratings. So hopefully webinars like this will help you. Great, so today we're looking at the statement workforce equality, diversity and inclusion. So I'm sure for everyone on this webinar, you'd appreciate that that's an incredibly huge topic to cover in such a short space of time. So we'll do what we can, but what we've done as a team is actually kind of pick some quite specific elements rather than working through such a generic or holistic conversation for you. So we've got here on this slide, this is the quality statement from the CQC. So we value diversity in our workforce and that we work towards an inclusive and fair culture by improving equality and equity for people who work for us. And then these underneath are all of the sort of subtopics and subcategories that the CQC will be looking at as part of their ongoing monitoring and regulation, and that us as providers should be having a think about when we're looking at this statement in our day-to-day practice. So we're going to have a look, as always, at the regulations, so trying to break down and demystify the legislation. It's not always the most fun part of being CQC compliant, but if we can get that right and understand the fundamentals, then it should help us kind of put that into context and understand how we can make that look in an everyday environment for people. So the two main regulations that cover this particular quality statement are Regulation 17, which is good governance. That's a friendly regulation under the well-led key question. It falls under all of them, and hopefully by now people will be familiar with what Regulation 17 means and stands for, and all of the different elements that come within that. And then we've also got Regulation 18, which looks at staffing, and you'll see that as we work through this presentation today, what we're really thinking about is the impact and the consideration not only for our patients and the local community that we're providing care and treatment for, but also for our staff and our workforce. So that's why that particular regulation is also to be considered as part of this. And then you've got your best practice guidance. So when you receive the slides, the red text for you there, that will take you directly to the CQC website, which then takes you through many links for some of the more popular best practice guidance or more recommended best practice guidance that we have a look at. So if we move through, perfect, thank you, Claire. So Regulation 17, I'm not going to read all of this for you, but what I've tried to do is, because it is quite a lengthy piece of legislation, but what I've tried to do is take out the specifics that apply to this particular quality statement. So we can see some of the snapshots that are considered here. So for example, providers must be able to show how they've analysed and responded to the information gathered, and then taken action to address the issues where they're raised. So when Claire has an opportunity to talk more about the well-led practice, there will be some more food for thought in this particular area about how the platform can help you understand exactly what the issues are across your workforce and within your staffing, within the culture of the organisation, and then some of the learning tools and the ongoing compliance tools that will be available to support you. Another example is that providers should actively seek the views of a wide range of stakeholders. So we know that stakeholders includes people who use our services, so patients, but it also includes any staff, any visiting professionals or professional bodies or other health and social care workers that we're doing joint up working with. So that could include our commissioners, our local groups, and it also includes members of the public and other bodies. And what we want to be doing is capturing their experience of the quality of care and treatment that's delivered by your service. And as we work through, we'll obviously link that more closely to the importance of equality, diversity and inclusion. And then we've just got some more on the right-hand side there that talks about the importance of actively encouraging feedback, and then making sure that we go beyond encouraging it, but we actively listen, and then we use that information to drive improvement and quality across the services that we're delivering. So then if we move across to Regulation 18, which is staffing. So a little bit less information here, but still really important to consider this. So this is looking at making sure that our workforce receive the support, training, professional development, supervision and appraisals that are necessary for them to carry out their roles and responsibilities. And I know we had some really good discussions at the last webinar about the importance of supporting the workforce, whether that be agency workers, looking at voluntary work and full-time members of staff as well. So it's important to take a holistic approach with that one. Then we're also looking at the importance of training and learning and development needs of individual staff members, thinking about them not only at the start of employment, so not only from an induction perspective, but also making sure that we review those opportunities at regular intervals during the course of employment. So from an equality, diversity and inclusion point of view, and we will touch on it more, but it's just making sure that we're not keeping that to quite a basic kind of e-learning opportunity, but actually expanding the offer that's available for staff so that we can cover this in a lot more detail. And then we want to be thinking about how staff are supported to undertake these opportunities, these development opportunities, to enable them to fulfil the requirements of their role. So for everyone who's also been with us in the past, and as Claire mentioned, what we look to do is break down the quality statement and then compare that with some of the more recently published reports from the CQC. So within this particular quality statement, there are actually 7 parts to it. So we're not going to go through all 7, but the slides will contain more information for you about that. So part 1, we've got here anything that's in red represents a report that had an inadequate rating. Orange reflects the requires improvement, and green would be good, and for blue it's services that have had outstanding. So I know that we said that there was no outstanding reports last month. This is from a historical report to give some examples for you. So here the CQC are going to be looking at how leaders take action to continually review and improve the culture of the organisation in the context of equality, diversity and inclusion. So we can see here that an inadequate service, they had a comment or some feedback from the CQC to say that the practice culture did not effectively support high quality, sustainable care, and that there was no vision or value shared with the whole team. So that's really important when we think about, hopefully everyone's got their statement of purpose in place, which talks about the visions and the values and the aims and objectives for your service, for your organisation, but making sure that that's shared with the team and known across the whole workforce is really important, and that it's continuously reviewed and updated in line with the growth or the development of the practice. When the CQC are interviewing or speaking to staff, they want to be hearing that the workforce know about the culture of the organisation and how you're working within the context of equality, diversity and inclusion. So it's really important to try and consider that as part of the everyday practice and the policies and the procedures that you've got. We've got here an example of a requires improvement service. So the CQC have commented that there was an annual staff survey and the practice leaders reviewed this and used it to identify areas for improvement. So that's fantastic. These were communicated to staff as 3 annual pledges, again, really positive and linked to the wider improvements in service delivery. And staff had reported that they felt the culture was equal and inclusive in providing opportunities, and that this had increased from 33 to 77%. So the reason that's probably had requires improvement is because it was a relatively new initiative that's come in. So it's not something that's yet had an opportunity or had the opportunity to demonstrate longevity or that it can be sustained. So again, we're always thinking about making sure that any initiatives that we introduce can be sustainable and kind of kept up to date over a long period of time. So if we have a look at part 2, thank you. So we've got here, leaders take action to improve where there are any disparities in the experience of staff with protected equality characteristics or those from excluded and marginalised groups. So again, we've got here some outstanding examples that the service promoted equality and diversity in daily work and provided opportunities for career development. And a good is that staff told us the management team and the lead clinicians acted as advocates and led by example. So again, that's really, really good. That's what we want to be seeing from an advocacy and leading by example perspective. But an inadequate example is that the practice did have a mission statement, but there was no evidence of a vision and strategy. The 2023 annual employee survey highlighted that only 14% of staff were clear on the visions and values of the practice. So you'll all agree that's incredibly low for the workforce to be aware of. It was out of date, and that the vision and the strategy. So although we're saying that they had a mission statement, it's not always enough to have that in place. You have to be able to then kind of translate that and make that available and accessible for the whole workforce, so that they're aware of exactly how you're working to meet a positive workforce from an equality, diversity and inclusion perspective. So if we will have a look at, let's skip down to part 7. So I realise I've skipped a lot, but there is lots more to get through. So part 7 is asking for leaders to, so we're demonstrating how leaders ensure that there are effective and proactive ways to engage with and involve staff, with a focus on hearing the voices of staff with protected characteristics and those who are excluded or marginalised, or who may be least heard within their service. And again, over the webinars that we've done, we have talked in quite a lot of depth actually about how we engage with staff who may not be the most heard or the most vocal or the loudest in the room. So this quality statement is really an opportunity to showcase how you're managing that particular element. So this has been reported on quite positively. So we can see that staff could give examples of how to protect patients from harassment and discrimination, including those with protected characteristics, and that staff described the Board of Trustees as highly responsive. They said they appreciated the board's willingness to challenge practice as part of continuous improvement. So I suppose that's a question that you could be asking yourself if you're practice manager on the call, or the registered manager or a lead clinician, is how willing are you to challenge any poor practice, and how do you think staff would respond to that question? How do you think your workforce would feel if that was a question that was posed to them by the CQC about your openness, transparency and willingness to challenge anything that went against best practice? And that staff have been able to describe the quality of their leadership positively and consistently told us that the leaders were always encouraging and supportive. So the Well-Led platform that Claire will go into detail is the perfect opportunity to be able to understand how your workforce are feeling about the leadership team and the management team. So if we move on to having a look at some of the detail as part of this. So the hopefully everyone here is familiar with the Winterbourne View report that came out. So this was actually in May 2011 that a panorama programme had exposed serious failings and abuse of people with learning disabilities and autism at Winterbourne View. So this was an independent sector hospital that did take NHS funded patients. And while the majority of patients' places had been purchased by NHS organisations, the events at Winterbourne View were of significant relevance to both the health and social care sector. So when we look at the report and some of the learning that's come from that, it's really important that some of the findings that came from that were the importance of promoting a culture and a way of working that actively challenges poor practice and promotes compassionate care across the system. And as a result, we need to see that leaders of organisations, or we did find that leaders of organisations were not fully held to account for poor quality care, and that the management actually allowed a culture of abuse to flourish. So some of the recommendations that came from that were that providers should provide effective and appropriate leadership, management, mentoring and supervision, and that good leadership was essential, and that we know it is essential in setting the culture and the values of an organisation. And that when we're thinking about recruitment, it's important that we're recruiting for values and ensuring that staff then have the training and the skills, which can include that training on values. So I'm just going to take a sip of water, I'm so sorry. The joys of a cold in the summer. So from this, when we think about winterbourne view, we often think about patients, and rightly so to a significant degree, because obviously the level of care and treatment that because of the level of care and treatment that they received. But when we're thinking about the key question of well-led, there are a huge amount of lessons that we can learn from this too, about the culture of the management team that ultimately allowed this abuse to take place. And hopefully, as we work through this webinar and the series of webinars, and when we're thinking about well-led as a key question, we're really using it as an opportunity to reflect on our leadership style and our management style, rather than necessarily thinking directly about the people who are receiving care and treatment. And by doing so, we'll be able to have a positive knock-on effect for people receiving care. So we've also provided some examples on the next slide from the Equality and Human Rights Commission. So there's loads of research out there for people to think about how we can consider this particular quality statement. And what I found really interesting about the research that's come from this is that there's often an assumed knowledge when it comes to moral principles or professionalism about equality, human rights, diversity and inclusion, simply because of the sector that we work in. And I suppose some people might not agree with me here, but I think when I was reflecting on this and thinking, when we think about friends or family that we have who work in other professions, such as hospitality, for example, or marketing, would we expect them to know less in terms of knowledge about human rights, equality and diversity than we do for people working in health and social care? And then do we take the time to reflect on the learning opportunities that we're providing for our workforce in this particular area? So often when I'm out doing inspections, I might see that people are doing e-learning on equality, diversity and human rights. They might have a discussion in a team meeting sort of once every 6 months where generic answers are given about what that means for the workforce. It's often covered in the induction because there'll be an equality and diversity policy that exists that staff have to read. But how do we really go above and beyond the fundamentals to ensure that we know how we're getting this right in everyday practice and then in line with best practice guidance and legislation? So as the Equality and Human Rights Commission have sort of fed back, is that we need to move away from a general discourse of the goodness of human rights and look at how institutional systems nurture or hinder this at the level of everyday practice, and that there is an assumption that people have perfect knowledge, that this is full information on all options and alternatives, and that all of our staff are armed with the knowledge with which they will behave individualistically according to their ends and means. But what the research has shown is that people rarely make decisions independent of others, particularly in the context of a caring, so a health and social care relationship, where behaviour is constrained by the expectations of others, and in particular by our management and our leadership team, and where we enhance our welfare through collaboration with others. So when I get onto the questions with Gary and Ketan, we'll explore that a little bit more, but I do think that's worth kind of bearing in mind and thinking about. So there's a little bit on the next slide for people about the gender pay gap. Again, a lot of this information, the guidance for providers is available in the public domain to make sure that you're compliant in this particular area. But overall, we know that in NHS England and NHS Improvement, women occupy, I think it's nearly 60% of the highest paid jobs, but also up nearly 80% of the lowest paid jobs. So a significant driver for the pay gap is having a smaller proportion of men in lower pay bands related to their share of the overall population. And so although the mean salaries for women across the pay bands 2 to 7 were higher, their mean earnings were considerably less than men across bands 8B and above. So reducing a mission or a goal to reduce the gender pay gap implies increasing the proportion of men in the organisation and then continuing the focus on creating pay equity across pay bands. So it's just, again, worth thinking about that, reflecting on that across your service. And here is just, and this slide just provides some information for you as an organisation about what your roles and responsibilities are as an employee. And then we've got some information here from the Well-Led platform that I know Claire will kind of do a deeper dive into afterwards, but some of the learning tools that are available from this particular platform show us that the evidence shows us that it's particularly the combination of diversity and inclusive practice that improve team performance, commitment, individual job satisfaction and well-being. So teams or team leaders, they may have little control over the diversity of the memberships in their team. And again, that's a question that comes up really regularly as part of the mock inspections or the CQC work that we do, about how do we go about kind of ticking that box or having that conversation around a diverse workforce. But actually, if we flip it on its head a bit and look at the importance of inclusivity, you then are able to have more of a direct impact from a diversity perspective as well. So there is always an opportunity to review and improve the inclusivity, and that the range of different experiences and mindsets available in the team, if they're encouraged and brought out by the team leader, the practice manager, the registered manager and their other colleagues, then you will see an improvement in decision making, which will ultimately enhance innovation. So here we've got everyday discrimination or exclusion, casual and often unconscious ways in which people can undermine each other can be more toxic to mental health and well-being than overt discrimination. And research has shown us that team leaders have a particularly important role to play in showing visible support to members of minority groups to facilitate a full contribution to the team. So it's really from here, the takeaway is that there's a lot of importance of actually encouraging people to share their experience and mindsets to improve inclusivity. So yeah, sort of taking a very proactive approach to that particular element. And then I think we've now got time for the, sorry everyone, the worst voice of the day. We've now got time for speaking with Gary and Ketan in the hot seat, and hopefully picking apart some of that learning. I do appreciate it's a really big topic. And there's, like I said earlier, there's absolutely lots to think about from a equality, diversity and inclusion perspective. So hopefully we'll get some food for thought now about some particular elements. So question number one for Gary. As a practice manager, was there ever a time that you had assumed your workforce would behave or conduct themselves in a certain way because that's the right thing to do, but in fact you saw that due to the culture of the organisation from the top down, this wasn't happening?
Yeah, so I can certainly think of times that were similar situation, and in fact many times, and my guess is most practice managers that will be on the call today will be able to relate to this. So I was at a practice where I think there was a fairly robust culture of do the right thing, but frequently things would be agreed, this is what the way we'd work, these are the values, the behaviours, whatever it was, and then you'd have somebody at the top, and it was usually a GP partner, that would do their own thing regardless of what was agreed, and everybody knew the expectations. They would do their own thing, and it was quite often because it was easier for them or it was better for them. So that was a sort of a regular occurrence. Fortunately, I was somewhere where culture held, to do the right thing, but it absolutely undermines that culture. So when that keeps on happening, it's a problem. But I think my advice, if you've got that situation, I think at the very start, agree the expectations. This is what everybody is expected to do, whether whatever it's about. And also what will happen when those expectations aren't met, how will things be dealt with? So I think, being clear on that. And then I think it's important for the leaders at the top, the practice managers, the partners, they've got to role model those expectations and behaviours. Others in the practice have got to see the things happening that everyone's agreed to. And then being brave, making sure that it's safe space to call out things that, aren't what was agreed and expected. So that situation, where one individual or small numbers would not do what's expected, happened a lot, but fortunately not a big cultural thing.
Great, thanks, Gary. Yeah, I mean that reflects really well then with we saw from the outstanding rating that when staff are able to say or demonstrate or feel quite confident to say to the CQC that they have faith in their leadership team to call out improper practice or unsafe an unsafe culture within the workforce, that can then lead to a more positive, in the long run, that can lead to a more positive and inclusive workforce. And it also kind of reflects the findings from the Equality and Human Rights Commission around this general discourse of good, which I think, is hopefully that's an important takeaway for people, that we do have to move beyond that and actually do some quite deep dives into what equality, diversity and inclusion looks like for your particular service. So thank you. Okay, Ketan, so the CQC are asking for the workforce to be representative of the population of people using the services. Probably shouldn't have used the word asking. I think they've put it in their quality statement as an expectation, but what are some of the pros and cons to this statement, and what top tips would you give for leaders to consider?
So I think this is one of those things that there's something written down on paper, and this is a quality statement, but what you say and what you do are very different things, and this is about promotion of what your culture is all about. And I think if people actually see what you claim to promote within your practice, and they see that inclusivity, that makes a massive difference around your culture. I think people feel safer to bring up issues if they can see that. I think if it's representative of the people that you actually look after, people will quite naturally just feel that this practice gets it, or this organization understands us, because they have people who might be going through similar difficulties or have been through similar difficulties. So I think it just, without saying it, extends that inclusive and empathic approach, which I think will be a big bonus, because it works the other way, because sometimes you have those limitations and you can't do the things that you'd like to do. But perhaps patients and staff will be more understanding as a result, because you don't come across as aloof and making decisions in an ivory tower. So I think that's really important. However, that can be easier said than done, because sometimes, and we have seen it in other arenas outside health, you might feel that you have to employ somebody because it meets your diversity requirements. And are you employing that person based on that basis? Is this a token gesture, or is it actually on their abilities? And I think people want to be there on merit ultimately. So it's a fine balance, I think, between the two. And sometimes actually the people that you employ, it's not that easy to get the people that you want to employ in any case. So it might be a difficult decision. It's in the back of your mind that your staff is as representative as possible, and the diversity that's there. But that might not actually be possible depending on who actually applies for the role, who actually is appropriate for that role.
Yeah, thanks, Ketan. You've actually opened my eyes there, because I think when I wrote that question, when I'm thinking about that particular quality statement on reflection, I think I'm thinking of almost the part two of what you've just provided there. I'm thinking about the quite fundamental points of view from a protected characteristic point of view. But actually, if you look at the first half of your answer, when you're thinking about making sure that your workforce are kind, compassionate, caring, responsive, and that they themselves, know what it's like to be, at the other end of receiving care and treatment from a GP, needing to access community services, pharmacy services, maybe some of the frustrations around that. Actually, that in itself is an opportunity to demonstrate that they're representative of the population and that they have an understanding of what people using the services are like. So I think that's a really good point that I've never thought about up until now. So yeah, thank you for that, and hopefully some learning for the others as well on the call. So question 3 for Gary. So the topics covered today add a real emphasis on how much the leadership team must do to get equality, diversity and inclusion right for their workforce. But how do you support practice managers now to ensure that they're also looking after their own health and well-being and checking in on their own sense of feeling included?
Yeah. So there's a small program that I'm working on at the moment, helping practice managers with portfolio careers. And we've dedicated some time in that program to talk to the people that are doing it about, you know, their own resilience, their continuing development, and their just general well-being. And, you know, these are monthly programs, and we've set up a WhatsApp group, so we are regularly checking in as well. So, you know, in terms of what I'm doing, you know, that's something I'm doing. But if you translate that to general practice, back to general practice and what practice managers can do and GP partners can do, I think the first thing is it's important to speak to people. You know, if you're the practice manager or the GP partners, get round and speak to the team, particularly the quiet ones, and don't accept, you know, answers of, yeah, I'm fine, I'm okay, or everything's good as being, you know, the answer. It may not be. So I think you've got to, you know, really check in and properly explore how people are feeling. And then the inclusion part of that question, make sure again that people are being included in discussions, their opinions are being sought. And back to the quiet ones again, particularly the quiet ones, you know, they're the ones that are often ignored and may be valuable. I think also explore any suspicions or concerns that might get fed back to you, you know, whether that's through the grapevine or in any other way. If you hear that, you know, a member of the team isn't doing so well, make sure you're exploring it, or not, you know, feeling included. Make sure that you're exploring it. And I think you need to do this regularly. You know, that on the previous question we talked about culture. I think make this a habit, make this something you're doing culturally, but not just a token gesture. It's something that, you know, does become an ingrained part of the culture. And just something that's last year's QI indicators for the workforce and well-being. I led a program on that for a couple of PCNs, and part of that was doing a very simple, it was about 6-question survey using Microsoft Forms. It took no time at all to do, but the actual information we got back was really, really, really valuable. A real good temperature check of how people were feeling. And actually now I think do that regularly, you know, do that maybe once a quarter to just find out how the team are doing, get some feedback. Doesn't mean you haven't got to speak to people individually, but it was a good temperature check of how people are doing. So, you know, do it regularly.
Brilliant, thanks Gary, that's helpful. Yeah, and I think for me, often when I'm out on inspection or when, you know, we're having discussions as a group, there's something about making sure. So one of my questions that I'll always ask is to a registered manager is, how does your manager, so the NI, the director, how do they support you? So what level of support are you getting? Because there is often a lot of pressure on the registered manager to get everything right for everybody else, but if they themselves aren't feeling right or included or heard or represented or, you know, advocated for in particular situations, then that will have, you know, for obvious reasons, that will have quite a knock-on effect on the culture that they're then, you know, delivering or kind of providing for the service. And actually one of the quality statements, we didn't stay on slide part 4 of the quality statements, but it does say that leaders take action to prevent and address bullying and harassment at all levels for all staff, with a clear focus on protected characteristics. So it's thinking, I guess that's another question for the practice managers who might be on this call, is having an opportunity to reflect, what support do you get? Do you feel that's sufficient? Is it enough? You know, do you feel there are gaps in areas that you need help with? And also, do your workforce support you? Do they kind of stick up for you? Is it a full cycle of you know, of support and inclusion in that sense? And if you think that there are gaps from your point of view, then that's something that might need exploring in more detail.
Yeah, if I can just add a bit then, Gabby, because I think you're right. It's for a practice manager, if they're not being included, that's really, really tough and difficult. But I think the way I would say deal with it is let it be clearly seen by everybody, by the partners, if they're the ones that aren't including you, that you're including others. And I would even be, the practice manager saying to the partners, what's your opinion? How are you feeling? Can I give you my opinion now? You've got to be bold, but I'd actually take a proactive lead on that. But it is a tough one, definitely.
Yeah, absolutely. And if anyone on the call has got any top tips for others about how they sort of look after themselves and and consider their own health and well-being, whether that be, as Gary mentioned, sort of parts of WhatsApp group, Facebook forums, ongoing development opportunities, then feel free to share. It would be interesting to know what's out there. So the last question for Ketan. So we must consider reasonable adjustments to support a person to carry out their role well, whilst also considering any impacts this would have on the provision of care for patients. So can you recall a time where a reasonable adjustment was successfully or not successfully implemented, and what were the outcomes?
So I have a very recent example. We had a member of our clinical staff who was struggling with a back injury, and actually what was going to work well was a standing desk, and I think actually it's a real dilemma actually when you get into these moments, because actually you have to make a decision as a business as well. There can be quite a cost to this, as you'll think, well, can we afford this? So it's a reasonable adjustment. But actually, when you think about it, the decision is actually really clear cut. Your role here is you have selected that member of staff to work with you. So it's incumbent on you to actually provide the best environment possible for them to thrive. And then it becomes really clear cut what you need to do. Because if you think about what might happen if you do something and if you don't do something. So if you don't do anything, the situation continues. The member of staff finds it increasingly difficult. That negativity then can spread to other members of staff. They will perhaps lose confidence in you as a practice and feel that, well, actually, what if I had a difficulty? Are they going to help me carry on doing the job that I want to do? And that's difficult to then go back the other way with that. Or do you go ahead and actually do something? There is a monetary cost to it, but you gain in spades further on, and it's a cumulative gain, because that member of staff will feel, one, that they're supported. They're more likely to go above and beyond for you. They'll be able to do their role better. Others will see that. That's a positive benefit on staff morale as well. And just as when you're having your staff appraisals, you might say, well, what are you looking to achieve in the next year? How do you want to improve? This kind of fits in the whole thing. What can we do to make this workplace the best possible for you to carry on working and actually enjoy your job? Because if you enjoy it, happy team, better outcome. It's as simple as that. I mean, I'm making it sound easier than it is because the costs are involved and it's not always that straightforward. But I think your opportunity cost for actually not doing something is much, much bigger and goes beyond financial.
Yeah, absolutely. Thanks, Ketan. I think, that there are always, it's never as straightforward as it sounds, but actually, like you said, once you kind of do a deep dive into it, it's quite a clear-cut decision to be made, isn't it? And I have a good example of a practice that I inspected many moons ago, pre-COVID, where they had 2 reception staff, one who had childcare duties in the morning, which meant that they weren't available to start work until after they dropped their child off at nursery. So sort of like looking at like 9:15, 9:30 for a practice that was open at 8, for the lines that were open at 8. But they also had another colleague who they'd noticed was coming to work quite late, quite often. So they initially went down the disciplinary route because of that, but actually when they spent time to understand what was going wrong, it's because this particular staff member was quite anxious about rush hour traffic, so that rush hour public transport. So it meant that they were delaying accessing public transport until it was less busy. So that I suppose in that sense, you've got 2 people who have reasonable adjustments that need to be considered, but they are both not available at the start of the day when the practice needs to be open. So it's how does the team work around that. So they were able to actually, you know, with consent, have the two colleagues speak to each other and kind of understand a little bit about where they were both coming from. And in the end, they did alternate days. So the days that the one particular staff member needed to do childcare, that the other staff member would come in earlier than rush hour, so kind of pre-work. And then on the other days, they were able to work from home and then come in later. So they found a way to kind of meet the needs of both staff members, while also making sure that the service could be delivered for the patients as well. So there are ways to get it right, but sometimes it's taking a step back, isn't it, and looking at the bigger picture. And in that circumstance, it was really positive that they were able to have an open dialogue with each other, because what that did is then build a positive working relationship in that particular department. So yeah, good outcomes there. So I think that's it from me. I'm going to hand over to Gary and Ketan, so thank you very much, and I will now hand over to Claire.
Thank you, Gabby. I am currently sitting at a standing desk that I haven't had in the standing position all day. However, I think it is true what Ketan alluded to, that a standing desk does sort of pay for itself in terms of keeping your staff happy and everybody's backs healthy and us all generally feeling a bit better. Also, just an observation to make from what Gabby said there, when I think about things from my mediator point of view, if I put my mediator hat on, often if you get people involved like that practice did with those two people, then you get a better solution than if you try and find some sort of reasonable adjustments yourselves. So I wouldn't be at all scared about sort of putting it back on the people and saying, you know, what is it that you want, to talk me through exactly your position so I understand it clearly. And then there might be a really nice, creative, easy, cheap way of sorting it out that keeps everybody really happy, like in that scenario. But anyway, we shall move on. So we've only got 10 minutes. I won't even take that. Just going to run you through the Well-Led Provider platform. Hopefully by now you know that it can help you to score good or outstanding and well-led, improving your teamwork, improving your leadership skills as an individual leader, or improving your leadership as the team as a whole, and therefore making your practice more sustainable, more resilient, more effective, delivering better patient outcomes. But specifically with regards to this well-led quality statement, we think back to the regulation. What you're expected to do is actively seek the views of your staff, which is what you can do through our platform, analyse those views, which is what we do for you, and then we present you with a report where we compare staff views to leadership team views, and we also compare your results to the average practice in our database. And then you can respond to the views that you found on the survey and make improvements. And the final thing that our platform does is it's stuffed full with guidance and exercises for you to then go away either as a group or individual to make those improvements yourself. You can then use our platform to do another survey like that practice did in the example at the beginning that Gabby showed you, and show that you've gone from 33% of your staff feeling valued to 77% or whatever. And you can do another one the next year to show it's embedded, and thereby getting through the compliance process with the CQC. The other thing that this well-led statement covers to a certain extent is appraisals and supportive appraisals. We skipped through that one for the interest of time, but when you get the slides, you'll see it. And the other thing that our platform provides you with is individual 360s for every single member of your team, whether they're clinical or non-clinical, very junior or the most senior person, so that you can make sure you are giving appraisals that are completely supportive, developmental, and centered around the person rather than being a sort of performance management or HR tool alone. Some of the questions that we ask your staff, this hasn't been updated, which is annoying. We ask your staff questions such as, do they feel that the appraisal process is supportive? Do they feel that the appraisal process works for them? Do they feel that everybody with a protected characteristic is treated fairly and equally? Again, providing the objective evidence for you to back up your claim that you'll make to the CQC that you are inclusive and that you value your diverse workforce and that you treat everyone fairly, including those with protected characteristics. What better way to be able to show it than to say that your staff agree with you in that? And we have some exercises for you to do to make sure that your appraisal processes are supportive. We have some exercises around stress at work, well-being and resilience, whether those are individual exercises where you are kind of rating yourself and evaluating yourself against certain tools or doing some group work around that. So there's plenty of stuff on our platform for you to get stuck in with, not just in terms of gathering objective evidence and seeking feedback from your staff, but also then doing any developmental work that needs to follow from it. For primary care, I think you're familiar with our prices by now. It's between 15 and 20p per patient for access for the whole year, to do as many reviews and individual 360s for as many members of your team as you want, and you can dip in and out of all of our libraries of guidance and exercises as you go. We've also now got a CQC package that Gabby provides us with, where she can come in and do a mock inspection at your site over the course of 2 days, not just against the well-led criteria, but the whole single assessment framework. And then she will keep checking in with you over the course of the following year to make sure that you're doing all of the action planning and developmental work and embedding all of the improvements that you make, which is what we've discussed as the CQC want to see. If you want to get a little idea of how our platform works from the point of view of one of your staff filling in a survey, then you can go to this QR code or click on the link when you get the slides, and you'll be able to do that without putting in any personal details or email addresses, and you can see what it feels like to do an assessment, and you will then get a free exercise out at the other end of it that you can then go away and develop work with on your team without any charge. And we'd be very grateful, like always, if you would complete our feedback form, which you can do so here, or you will get emailed about afterwards, because we do look at it all and we try to take it on board. But let's see if we've got any questions before we finish. Otherwise, you've got 8 minutes back of your lives. Have we got anything? Feel free to stick something in now or even raise your hand. Or put it on the feedback form at the end and we can get back to you personally if you prefer to ask a question in private.
I think just to button that, if anyone, people don't have questions, but when people provide feedback, it would be really helpful for us as a team as well, and we can share this learning sort of on LinkedIn afterwards. If anyone has any feedback about how they are going above and beyond we talked about the kind of assumed understanding of equality and diversity and the basics that can be offered within a service. But if anyone has any ideas of kind of initiatives or above and beyonds that they've implemented to look at this particular quality statement, it would be really helpful. So if you are able to include those in the feedback, and like I said, we can all share some of that on our LinkedIn posts as a follow-up, it would be really appreciated. Thank you.
Thank you, Gabby. Kitan and Gary, anything you'd like to add before we wrap things up?
Nothing from my point of view. No, I mean, another really interesting webinar. So thank you.
Thank you, Barrett. Thank you for coming along, Gary. And we will hopefully see you all for webinar number 5, which you'll get emails about shortly. And we do have a PCN incorporation webinar in a couple of weeks' time, which you should also have got an email about if you're working in primary care, that is. So we will see you all soon, but do feel free to reach out to us and we will get back to you, answer your questions, get you started with a free trial, whatever it is you'd like from us. Take care, everyone.
Thank you all.